When monitoring a patient's response to oral antidiabetic drugs, the nurse knows that which laboratory result would indicate a therapeutic response. A. Random blood glucose level 180 mg per deciliter. B. Blood glucose level of 50 mg per deciliter after meals. C. Fasting blood glucose level of 92 mg per deciliter. D. Evening blood glucose level below 80 mg per deciliter. Answer: C. Fasting blood glucose level of 92 mg per deciliter. Rationale: the American Diabetes Association recommends a fasting blood glucose level of between 70 and 130 mg per deciliter for diabetic patients. The other options are incorrect. When teaching about hypoglycemia, the nurse will make sure that the patient is aware of the early signs of hypoglycemia, including which of these? A. Hypothermia and seizures. B. Nausea and diarrhea. C. Confusion and sweating. D. Fruity, acetone odor to the breath. Answer: C. Confusion and sweating. Rationale: early symptoms of hypoglycemia include the central nervous system manifestations of confusion, irritability, tremor, and sweating. Hypothermia and seizures are later symptoms of hypoglycemia. The other options are incorrect. The nurse is teaching a group of patients about self-administration of insulin. What content is important to include? A. Patients need to use the injection site that is the most accessible. B. If two different insulins are ordered, they need to be given in separate injections. C. When mixing insulins, the cloudy, such as NPH, insulin is drawn up into the syringe first. D. When mixing insulins, the clear, such as regular, insulin is drawn up into the syringe first. Answer: D. When mixing insulins, the clear, such as regular, insulin is drawn up into the syringe first. Rationale: if mixing insulins in one syringe, the clear, regular, insulin is always drawn up into the syringe first. Patients always need to rotate injection sites. Mixing of insulins may be ordered. A 75-year-old woman with type 2 diabetes has recently been placed on glipizide, glucotrol. She asks the nurse when the best time would be to take this medication. What is the nurse's best response? A. Take this medication in the morning, 30 minutes before breakfast. B. Take this medication in the evening with a snack. C. This medication needs to be taken after the midday meal. D. It does not matter what time of day you take this medication. Answer: A. Take this medication in the morning, 30 minutes before breakfast. Rationale: glipizide is taken in the morning, 30 minutes before breakfast. This allows the timing of the insulin secretion induced by the glipizide to correspond with the elevation in blood glucose level induced by the meal in much the same way as endogenous insulin levels are raised in a person without diabetes. A patient who has type 2 diabetes is scheduled for an oral endoscopy and has been NPO, nothing by mouth, since midnight. What is the best action by the nurse regarding the administration of her oral antidiabetic drugs? A. Administer half the original dose. B. Withhold all medications as ordered. C. Contact the prescriber for further orders. D. Give the medication with a sip of water. Answer: C. Contact the prescriber for further orders. Rationale: when the diabetic patient is NPO, the prescriber needs to be contacted for further orders regarding the administration of the oral antidiabetic drugs. The other options are incorrect. The nurse is reviewing instructions for a patient with type 2 diabetes who also takes insulin injections as part of the therapy. The nurse asks the patient, "What should you do if your fasting blood glucose is 47 milligrams per deciliter?" Which response by the patient reflects a correct understanding of insulin therapy? A. I will call my doctor right away. B. I will give myself the regular insulin. C. I will take an oral form of glucose. D. I will rest until the symptoms pass. Answer. C. I will take an oral form of glucose. Rationale. Hypoglycemia can be reversed if the patient eats glucose tablets or gel, corn syrup, or honey, or drinks fruit juice or a non-dit soft drink or other quick sources of glucose, which must always be kept at hand. The patient should not wait for instructions from the physician, nor delay taking the glucose by resting. The regular insulin would only lower the blood glucose levels more. The nurse is teaching patients about self-injection of insulin. Which statement is true regarding injection sites? A. Avoid the abdomen because absorption there is irregular. B. Choose a different site at random for each injection. C. Give the injection in the same area each time. D. Rotate sites within the same location for about 1 week before rotating to a new location. Answer. D. Rotate sites within the same location for about 1 week before rotating to a new location. Rationale. Patients taking insulin injections need to be instructed to rotate sites, but to do so within the same location for about 1 week, so that all injections are rotated in one area, for example, the right arm, before rotating to a new location, such as the left arm. Also, each injection needs to be at least 1/2 to 1 inch away from the previous site. Which action is most appropriate regarding the nurse's administration of a rapid-acting insulin to a hospitalized patient? A. Give it within 15 minutes of mealtime. B. Give it after the meal has been completed. C. Administer it once daily at the time of the midday meal. D. Administer it with a snack before bedtime. Answer. A. Give it within 15 minutes of mealtime. Rationale. Rapid-acting insulins are able to mimic closely the body's natural rapid insulin output after eating a meal. For this reason, these insulins are usually administered within 15 minutes of the patient's mealtime. The other options are incorrect. A patient in the emergency department was showing signs of hypoglycemia and had a fingerstick glucose level of 34 milligrams per deciliter. The patient has just become unconscious. The nurse will anticipate which action to be next. A. Having the patient eat glucose tablets. B. Having the patient consume fruit juice, a non-dit soft drink, or crackers. C. Administering intravenous glucose, 50% dextrose. D. Calling the lab to order a fasting blood glucose level. Answer. C. Administering intravenous glucose, 50% dextrose. Rationale. Intravenous glucose raises blood glucose levels when the patient is unconscious and unable to take oral forms of glucose. Having the lab draw a fasting glucose level is not an appropriate action at this time. After starting treatment for type 2 diabetes mellitus 6 months earlier, a patient is in the office for a follow-up examination. The nurse will monitor which laboratory test to evaluate the patient's adherence to the anti-diabetic therapy over the past few months. A. Hemoglobin levels. B. Hemoglobin A1C level. C. Fingerstick fasting blood glucose level. D. Serum insulin levels. Answer. B. Hemoglobin A1C level. Rationale. The hemoglobin A1C level reflects the patient's adherence to the therapy regimen for several months previously, thus evaluating how well the patient has been doing with diet and drug therapy. The other options are incorrect. The nurse is preparing to administer insulin intravenously. Which statement about the administration of intravenous insulin is true? A. Insulin is never given intravenously. B. Only regular insulin can be administered intravenously. C. Insulin aspart or insulin lispro can be administered intravenously, but there must be a 50% dose reduction. D. Any form of insulin can be administered intravenously at the same dose as that is ordered for subcutaneous administration. Answer: B. Only regular insulin can be administered intravenously. Rationale: regular insulin is the usual insulin product to be dosed via intravenous bolus, intravenous infusion, or even intramuscularly. These routes, especially the intravenous infusion route, are often used in cases of diabetic ketoacidosis, or coma associated with uncontrolled type 1 diabetes. A patient with a history of chronic obstructive pulmonary disease, COPD, and type 2 diabetes has been treated for pneumonia for the past week. The patient has been receiving intravenous corticosteroids as well as antibiotics as part of his therapy. At this time, the pneumonia has resolved, but when monitoring the blood glucose levels, the nurse notices that the level is still elevated. What is the best explanation for this elevation? A. The antibiotics may cause an increase in glucose levels. B. The corticosteroids may cause an increase in glucose levels. C. His type 2 diabetes has converted to type 1. D. The hypoxia caused by the COPD causes an increased need for insulin. Answer: B. The corticosteroids may cause an increase in glucose levels. Rationale: corticosteroids can antagonize the hypoglycemic effects of insulin, resulting in elevated blood glucose levels. The other options are incorrect. The nurse knows to administer a carbose, precautions, an alpha-glucosidase inhibitor, at which time? A. 30 minutes before breakfast. B. With the first bite of each main meal circa 30 minutes after breakfast. D. Once daily at bedtime. Answer: B. With the first bite of each main meal. Rationale: when an alpha-glucosidase inhibitor is taken with the first bite of a meal, excessive postprandial blood glucose elevation, a glucose spike, can be reduced or prevented. When administering morning medications for a newly admitted patient, the nurse notes that the patient has an allergy to sulfa drugs. There is an order for the sulfonylurea glipizide, glucotrol. Which action by the nurse is correct? A. Give the drug as ordered 30 minutes before breakfast. B. Hold the drug and check the order with the prescriber. C. Give a reduced dose of the drug with breakfast. D. Give the drug and monitor for adverse effects. Answer: B. Hold the drug and check the order with the prescriber. Rationale: there is a potential for cross-allergy in patients who are allergic to sulfonamide antibiotics. Although such an allergy is listed as a contraindication by the manufacturer, most clinicians do prescribe sulfonylureas for such patients. The order needs to be clarified. A patient has been diagnosed with metabolic syndrome and is started on the biguanide metformin, glucophage. The nurse knows that the purpose of the metformin, in this situation, is which of these? A. To increase the pancreatic secretion of insulin. B. To decrease insulin resistance. C. To increase blood glucose levels. D. To decrease the pancreatic secretion of insulin. Answer: B. To decrease insulin resistance. Rationale: metformin decreases glucose production by the liver, decreases intestinal absorption of glucose, and improves insulin receptor sensitivity in the liver, skeletal muscle, and adipose tissue, resulting in decreased insulin resistance. The other options are incorrect. A patient will be taking U-500 insulin. The nurse is reviewing the use of this drug. Which of these statements are true? Select all that apply. A. U-500 insulin is 5 times stronger than U-100 insulin. B. U-500 insulin syringes must be used when giving U-500 insulin. C. U-500 syringes can deliver 500 units of insulin. D. Each line on a U-500 syringe measures 5 units of U-500 insulin. E. U-500 insulin delivers a smaller dose of insulin in a single injection. Answer: A. U-500 insulin is 5 times stronger than U-100 insulin. B. U-500 insulin syringes must be used when giving U-500 insulin. D. Each line on a U-500 syringe measures 5 units of U-500 insulin. Rationale: U-500 insulin is 5 times stronger than U-100 insulin, and must be given with a U-500 syringe. Each line on a U-500 syringe measures 5 units of U-500 insulin. U-500 syringes can deliver 5 to 250 units of insulin. This insulin is more concentrated than regular strength insulin and can deliver a larger dose of insulin in a single injection. A patient is taking a sulfonylurea medication for new-onset type 2 diabetes mellitus. When reviewing potential adverse effects during patient teaching, the nurse will include information about which of these effects. Select all that apply. A. Hypoglycemia. B. Nausea. C. Diarrhea. D. Weight gain. E. Peripheral edema. Answer: A. Hypoglycemia. B. Nausea. D. Weight gain. Rationale: the most common adverse effect of the sulfonylureas is hypoglycemia, the degree to which depends on the dose, eating habits, and presence of hepatic or renal disease. Another predictable adverse effect is weight gain because of the stimulation of insulin secretion. Other adverse effects include skin rash, nausea, epigastric fullness, and heartburn. The insulin order reads: give 10 units of NPH insulin and 5 units of regular insulin, sub-Q, every morning before breakfast. Choose the proper syringe for this injection. Answer: B. Rationale: the proper syringe for insulin injection is the insulin syringe, which is marked in units. The other syringes listed are not correct for use with insulin because they are not marked in units. When teaching a patient who is starting metformin, glucophage, which instruction by the nurse is correct? A. Take metformin if your blood glucose level is above 150 mg per deciliter. B. Take this 60 minutes after breakfast. C. Take the medication on an empty stomach 1 hour before meals. D. Take the medication with food to reduce gastrointestinal, GI, effects. Answer: D. Take the medication with food to reduce gastrointestinal, GI, effects. Rationale: the GI adverse effects of metformin can be reduced by administering it with meals. The other options are incorrect. The nurse is teaching a group of patients about management of diabetes. Which statement about basal dosing is correct? A. Basal dosing delivers a constant dose of insulin. B. With basal dosing, you can eat what you want and then give yourself a dose of insulin. C. Glargine insulin is given as a bolus with meals. D. Basal bolus dosing is the traditional method of managing blood glucose levels. Answer: A. Basal dosing delivers a constant dose of insulin. Rationale: basal bolus therapy is the attempt to mimic a healthy pancreas by delivering basal insulin constantly as a basal, and then as needed as a bolus. Glargine insulin is used as a basal dose, not as a bolus with meals. Basal bolus therapy is a newer therapy. Historically, sliding scale coverage was implemented. The nurse is teaching a review class to nurses about diabetes mellitus. Which statement by the nurse is correct? A. Patients with type 2 diabetes will never need insulin. B. Oral antidiabetic drugs are safe for use during pregnancy. C. Pediatric patients cannot take insulin. D. Insulin therapy is possible during pregnancy if managed carefully. Answer: D. Insulin therapy is possible during pregnancy if managed carefully. Rationale: oral medications are generally not recommended for pregnant patients because of a lack of firm safety data. For this reason, insulin therapy is the only currently recommended drug therapy for pregnant women with diabetes. Insulin is given to pediatric patients with extreme care. Patients with type 2 diabetes may require insulin in certain situations or as their disease progresses. The nurse is reviewing a patient's medication list and notes that sitagliptin, Januvia, is ordered. The nurse will question an additional order for which drug or drug class. A. Glitazone. B. Insulin. C. Metformin, glucophage. D. Sulfonylurea. Answer: B. Insulin. Rationale: sitagliptin is indicated for management of type 2 diabetes either as monotherapy or in combination with metformin, a sulfonylurea, or a glitazone, but not with insulin. The nurse is administering insulin lispro, Humalog, and will keep in mind that this insulin will start to have an effect within which time frame? A. 15 minutes. B. 1 to 2 hours circa 80 minutes. D. 3 to 5 hours. Answer: A. 15 minutes. Rationale: the onset of action for insulin lispro is 15 minutes. The peak plasma concentration is 1 to 2 hours, the elimination half-life is 80 minutes, and the duration of action is 3 to 5 hours. A newly admitted patient reports a penicillin allergy. The prescriber has ordered a second-generation cephalosporin as part of therapy. Which nursing action is appropriate? A. Call the prescriber to clarify the order because of the patient's allergy. B. Give the medication and monitor for adverse effects. C. Ask the pharmacy to change the order to a first-generation cephalosporin. D. Administer the drug with a nonsteroidal anti-inflammatory drug to reduce adverse effects. Answer: A. Call the prescriber to clarify the order because of the patient's allergy. Rationale: the given example presents a patient who is experiencing penicillin allergy. The patient was prescribed with a second-generation cephalosporin as a therapeutic intervention. The most appropriate nursing intervention is to confirm on the prescription and not in administering the medicine and then look for adverse effects. Hence, the option B is incorrect. The appropriate nursing intervention for the given situation is to confirm the prescription and not in changing the prescription without consultation with the prescriber. Hence, the option C is incorrect. Also, administering an anti-inflammatory drug to prevent adverse effects of the cephalosporin is not an appropriate nursing intervention. Hence, the option D is incorrect. The most appropriate nursing intervention for the given condition is to confirm the order for cephalosporin with the prescriber as the patient has experienced penicillin allergy. A teenage patient is taking a tetracycline drug as part of treatment for severe acne. When the nurse teaches this patient about drug-related precautions, which is the most important information to convey? A. When the acne clears up, the medication may be discontinued. B. This medication needs to be taken with antacids to reduce GI upset. C. The patient needs to use sunscreen or avoid exposure to sunlight because this drug may cause photosensitivity. D. The teeth should be observed closely for signs of mottling or other color changes. Answer: C. The patient needs to use sunscreen or avoid exposure to sunlight because this drug may cause photosensitivity. Rationale: the given example presents a teenage patient who is on treatment with tetracycline drug to control acne. The most important drug-related precaution that should be taught to the patient is in using additional measure and not in instructing to discontinue the medicine as soon as the acne disappears. Hence, the option A is incorrect. The tetracycline drug being prescribed to the patient to treat acne will not cause gastrointestinal upset as can be prevented by administering antacids. Hence, the option B is incorrect. The most important instruction that should be provided to a teenage patient with acne and is being treated with tetracycline drugs is in taking additional measures apart from the drug therapy. Instructing the patient to monitor for teeth color changes or molting is not of immediate concern. Hence, the option D is incorrect. In patent presented in the given example should be instructed in taking additional precautions such as avoiding exposure to sunlight as the drug can induce photosensitivity as an adverse effect. A patient is scheduled for colorectal surgery tomorrow. He does not have sepsis, his WBC count is normal, he has no fever, and he is otherwise in good health. However, there is an order to administer an antibiotic on call before he goes to surgery. The nurse knows the rationale for this antibiotic order is to A. Provide empiric therapy, B. Provide prophylactic therapy, C. Treat for a superinfection, D. Reduce the number of resistant organisms. Answer: B. Provide prophylactic therapy. Rationale: the given example presents a patient who is being prepared for surgery the next day. Though several blood and other physiological parameters are in normal range, the patient has been prescribed with an antibiotic order. Empiric therapy is the type of therapy which is provided to a patient based on the physician's discretion and is not a preventive type as being administered to the patient in the given example. Hence, the option A is incorrect. The patient presented in the given example has no known infection and the antibiotic prescription is for preventive purposes and not to treat a superinfection. Hence, the option C is incorrect. Also, antibiotics are not administered to control the number of resistant organisms. Hence, the option D is incorrect. The antibiotic order for the patient in the given example is towards providing prophylactic therapy as a preventive measure. While assessing a woman who is receiving an antibiotic for community-acquired pneumonia, the nurse notes that the patient has a thick, white vaginal discharge. The patient is also complaining about perineal itching. The nurse suspects that the patient has a resistance to the antibiotic. B. An adverse effect of the antibiotic. C. A superinfection. D. An allergic reaction. Answer: C. A superinfection. Rationale: the given example presents a patient who is to being assessed after receiving an antibiotic to treat pneumonia that was community-acquired. The patient was experiencing thick, whitish vaginal discharge. This condition suggests the occurrence of a superinfection and not the development of antibiotic resistance. Option A. The condition and the associated symptoms are also not as a result of adverse effects of the antibiotic. Option B. The occurrence of a thick, whitish discharge indicates a severe infection is not an allergic reaction. Option D. The symptoms of the patient presented in the given example suggest the onset of a superinfection. A patient has been admitted for treatment of an infected leg ulcer and will be started on intravenous Linezolid. The nurse is reviewing the list of the patient's current medications. Which type of medication, if listed, would be of most concern if taken with Linezolid? A. Beta blocker. B. Oral anticoagulant. C. Selective serotonin reuptake inhibitor antidepressant. D. Thyroid replacement hormone. Answer. C. Selective serotonin reuptake inhibitor antidepressant. Rationale. The given example presents a patient who will be started on intravenous Linezolid as a treatment for infected leg ulcer. Beta blockers have no contraindications or drug interactions with Linezolid. Hence, the option A is incorrect. Also, oral anticoagulants do not have known drug interactions with Linezolid, and patients can be administered Linezolid even if they are on oral anticoagulant therapy. Hence, the option B is incorrect. Linezolid therapy is also not contraindicated in patients who are on thyroid replacement therapy. Hence, the option D is incorrect. The drug Linezolid has contraindications and drug interaction with selective serotonin reuptake inhibitor antidepressant. Hence, patients who are to receive intravenous Linezolid should first be checked if they are on selective serotonin reuptake inhibitor antidepressant therapy. When administering vancomycin, the nurse knows that which of these is most important to assess before giving the medication. A. Renal function. B. WBC count. C. Liver function. D. Platelet count. Answer. A. Renal function. Rationale. Vancomycin is an antibiotic drug used normally for a variety of bacterial infections and is available as oral or intravenous drug forms. This antibiotic has no effect on the white blood cell, WBC counts, and hence, the count of WBCs need not be assessed before a patient is administered with vancomycin. Hence, the option B is incorrect. Also, vancomycin is not known to affect liver function. Hence, the option C is incorrect. Similar to the WBC's counts, vancomycin also has no known effect on the platelet count. Hence, the option D is incorrect. The most appropriate parameter to be assessed in a patient who is about to receive vancomycin is the kidney renal function. When a patient is on aminoglycoside therapy, the nurse will monitor the patient for which indicators of potential toxicity? A. Fever. B. White blood cell count of 8,000 cells per millimeter 3C. Tinnitus and dizziness. D. Decreased blood urea nitrogen, BUN, levels. Answer. C. Tinnitus and dizziness. Rationale. Dizziness, tinnitus, hearing loss, or a sense of fullness in the ears could indicate ototoxicity, a potentially serious toxicity in a patient. Nephrotoxicity is indicated by rising blood urea nitrogen and creatinine levels. Fever may be indicative of the patient's infection. A white blood cell count of 7,000 cells per millimeter 3 is within the normal range of 5,000 to 10,000 cells per millimeter 3. A patient will be receiving Nitrofurantoin, macrodantin, treatment for a urinary tract infection. The nurse is reviewing the patient's history and will question the Nitrofurantoin order if which disorder is present in the history. Select all that apply. A. Liver disease. B. Coronary artery disease. C. Hyperthyroidism. D. Type 1 diabetes mellitus E. Chronic renal disease. Answer. A. Liver disease E. Chronic renal disease rationale. Nitrofurantoin is contraindicated in cases of known drug allergy and also in cases of significant renal function impairment. Because the drug concentrates in the urine. Because adverse effects include hepatotoxicity, which is rare but often fatal, the nurse should also question the order if liver disease is present. The other options are not contraindications. The nurse is administering a vancomycin infusion. Which measure is appropriate for the nurse to implement in order to reduce complications that may occur with this drug's administration? A. Monitoring blood pressure for hypertension during the infusion. B. Discontinuing the drug immediately if red man syndrome occurs. C. Restricting fluids during vancomycin therapy. D. Infusing the drug over at least 1 hour. Answer. D. Infusing the drug over at least 1 hour. Rationale. Infuse the medication over at least 1 hour to reduce the occurrence of red man syndrome. Adequate hydration, at least 2 L of fluid in 24 hours, during vancomycin therapy is important for the prevention of nephrotoxicity. Hypotension may occur during the infusion, especially if it is given too rapidly. The nurse is administering intravenous vancomycin, to a patient who has had gastrointestinal surgery. Which nursing measures are appropriate? Select all that apply. A. Monitoring serum creatinine levels. B. Restricting fluids while the patient is on this medication. C. Warning the patient that a flushed feeling or facial itching may occur. D. Instructing the patient to report dizziness or a feeling of fullness in the ears. E. Reporting a trough drug level of 11 mcg per milliliter and holding the drug. F. Reporting a trough drug level of 24 mcg per milliliter and holding the drug. Answer. A. Monitoring serum creatinine levels. C. Warning the patient that a flushed feeling or facial itching may occur. D. Instructing the patient to report dizziness or a feeling of fullness in the ears. F. Reporting a trough drug level of 24 mcg per milliliter and holding the drug. Rationale. Constant monitoring for drug-related neurotoxicity, nephrotoxicity, ototoxicity, and superinfection remain critical to patient safety. Monitor for nephrotoxicity by monitoring serum creatinine levels. Ototoxicity may be indicated if the patient experiences dizziness or a feeling of fullness in the ears, and these symptoms must be reported immediately. Vancomycin infusions may cause red man syndrome, which is characterized by flushing of the neck and face and a decrease in blood pressure. In addition, adequate hydration, at least 2 L of fluids every 24 hours unless contraindicated, is most important to prevent nephrotoxicity. Optimal trough blood levels of vancomycin are 10 to 20 mcg per milliliter. Therefore, the drug should not be administered when there is a trough level of 24 mcg per milliliter. A 79-year-old patient is receiving a Quinolone as treatment for a complicated incision infection. The nurse will monitor for which adverse effect that is associated with these drugs. A. Neuralgia. B. Double vision. C. Hypotension. D. Tendinitis and tendon rupture. Answer. D. Tendinitis and tendon rupture. Rationale. A black box warning is required by the U.S. Food and Drug Administration for all quinolones because of the increased risk for tendinitis and tendon rupture with use of the drugs. This effect is more common in elderly patients, patients with renal failure, and those receiving concurrent glucocorticoid therapy, e.g., prednisone. The other options are not common adverse effects. A Patient has been diagnosed with carbapenemase-resistant Enterobacteriaceae, CRE. The nurse expects to see orders for which drug? A. Dapsone, Cubicin, a miscellaneous antibiotic. B. Ciprofloxacin, Cipro, a Quinolone. C. Linezolid, Zyvox, and oxazolidinone. D. Cholistomethate sodium, Cholimycin, a polypeptide antibiotic. Answer: D. Cholistomethate sodium, Cholimycin, a polypeptide antibiotic. Rationale: cholistomethate, Cholimycin, commonly referred to as colistin, is now being used again, often as one of the only drugs available to treat CRE. The other options are incorrect. The nurse checks the patient's laboratory work prior to administering a dose of vancomycin, Vancomycin, and finds that the trough vancomycin level is 24 mcg per milliliter. What will the nurse do next? A. Administer the vancomycin as ordered. B. Hold the drug and administer 4 hours later. C. Hold the drug and notify the prescriber. D. Repeat the test to verify results. Answer: C. Hold the drug and notify the prescriber. Rationale: optimal blood levels of vancomycin are a trough level of 10 to 20 mcg per milliliter. Measurement of peak levels is no longer routinely recommended, and only trough levels are commonly monitored. Blood samples for measurement of trough levels are drawn immediately before administration of the next dose. Because of the increase in resistant organisms, many clinici use a trough level of 15 to 20 mcg per milliliter as their goal. These trough levels mean that even just before the next dose is due, when drug levels should be low, the drug levels are actually too high. The nurse is reviewing the medication orders for a patient who will be receiving gentamicin therapy. Which other medication or medication class, if ordered, would be a potential interaction concern? A. Calcium channel blockers. B. Phenytoin. C. Proton pump inhibitors. D. Loop diuretics. Answer: D. Loop diuretics. Rationale: concurrent use of aminoglycosides, such as gentamicin, with loop diuretics increases the risk for ototoxicity. The other drugs and drug classes do not cause interactions. A patient is receiving aminoglycoside therapy and will be receiving a beta-lactam antibiotic as well. The patient asks why 2 antibiotics have been ordered. What is the nurse's best response? A. The combined effect of both antibiotics is greater than each of them alone. B. One antibiotic is not strong enough to fight the infection. C. We have not yet isolated the bacteria, so the 2 antibiotics are given to cover a wide range of microorganisms. D. We can give a reduced amount of each one if we give them together. Answer: A. The combined effect of both antibiotics is greater than each of them alone. Rationale: aminoglycosides are often used in combination with other antibiotics, such as beta-lactams or vancomycin, in the treatment of various infections because the combined effect of the 2 antibiotics is greater than that of either drug alone. A patient who has been hospitalized for 2 weeks has developed a pressure ulcer that contains multidrug-resistant Staphylococcus aureus, MRSA. Which drug would the nurse expect to be chosen for therapy? A. Metronidazole, Flagyl. B. Ciprofloxacin, Cipro. C. Vancomycin, Vancomycin. D. Tobramycin, Nebsen. Answer: C. Vancomycin, Vancomycin. Rationale: vancomycin is the drug of choice for the treatment of MRSA. The other drugs are not used for MRSA. Which nursing diagnosis is appropriate for a patient who has started aminoglycoside therapy? A. Constipation. B. Risk for injury, renal damage. C. Disturbed body image related to gynecomastia. D. Imbalanced nutrition, less than body requirements, related to nausea. Answer. B. Risk for injury, renal damage. Rationale. Patients on aminoglycoside therapy have an increased risk for injury caused by nephrotoxicity. The other options are incorrect. The nurse is providing teaching to a patient taking an oral tetracycline antibiotic. Which statement by the nurse is correct? A. Avoid direct sunlight and tanning beds while on this medication. B. Milk and cheese products result in increased levels of tetracycline. C. Antacids taken with the medication help to reduce gastrointestinal distress. D. Take the medication until you are feeling better. Answer. A. Avoid direct sunlight and tanning beds while on this medication. Rationale. Drug-related photosensitivity occurs when patients take tetracyclines, and it may continue for several days after therapy. Milk and cheese products result in decreased levels of tetracycline when the two are taken together. Antacids also interfere with absorption and should not be taken with tetracycline. Counsel patients to take the entire course of prescribed antibiotic drugs, even if they feel that they are no longer ill. When reviewing the allergy history of a patient, the nurse notes that the patient is allergic to penicillin. Based on this finding, the nurse would question an order for which class of antibiotics. A. Tetracyclines. B. Sulfonamides. C. Cephalosporins. D. Quinolones. Answer. C. Cephalosporins. Rationale. Allergy to penicillin may also result in hypersensitivity to cephalosporins. The other options are incorrect. When reviewing the medication orders for a patient who is taking penicillin, the nurse notes that the patient is also taking the oral anticoagulant warfarin, Coumadin. What possible effect may occur as the result of an interaction between these drugs? A. The penicillin will cause an enhanced anticoagulant effect of the warfarin. B. The penicillin will cause the anticoagulant effect of the warfarin to decrease. C. The warfarin will reduce the anti-infective action of the penicillin. D. The warfarin will increase the effectiveness of the penicillin. Answer. A. The penicillin will cause an enhanced anticoagulant effect of the warfarin. Rationale. Administering penicillin reduces the vitamin K in the gut, intestines, therefore, enhanced anticoagulant effect of warfarin may occur. The other options are incorrect. A patient is receiving his third intravenous dose of a penicillin drug. He calls the nurse to report that he is feeling anxious and is having trouble breathing. What will the nurse do first? A. Notify the prescriber. B. Take the patient's vital signs. C. Stop the antibiotic infusion. D. Check for allergies. Answer. C. Stop the antibiotic infusion. Rationale. Hypersensitivity reactions are characterized by wheezing, shortness of breath, swelling of the face, tongue, or hands, itching, or rash. The nurse should immediately stop the antibiotic infusion, have someone notify the prescriber, and stay with the patient to monitor the patient's vital signs and condition. Checking for allergies should have been done before the infusion. A patient is admitted with a fever of 102.8 degrees Fahrenheit, 39.3 degrees Celsius, origin unknown. Assessment reveals cloudy, foul-smelling urine that is dark amber in color. Orders have just been written to obtain stat urine and blood cultures and to administer an antibiotic intravenously. The nurse will complete these orders in which sequence? A. Blood culture, antibiotic dose, urine culture B. Urine culture, antibiotic dose, blood culture C. Antibiotic dose. Blood and urine cultures D. Blood and urine cultures, antibiotic dose. Answer: D. Blood and urine cultures, antibiotic dose. Rationale: culture specimens should be obtained before initiating antibiotic drug therapy. Otherwise, the presence of antibiotics in the tissues may result in misleading culture and sensitivity results. The other responses are incorrect during drug therapy with a tetracycline antibiotic. A patient complains of some nausea and decreased appetite. Which statement is the nurse's best advice to the patient? A. Take it with cheese and crackers or yogurt. B. Take each dose with a glass of milk. C. Take an antacid with each dose as needed. D. Drink a full glass of water with each dose. Answer: D. Drink a full glass of water with each dose. Rationale: oral doses should be given with at least 8 ounces of fluids and food to minimize gastrointestinal upset. However, antacids and dairy products will bind with the tetracycline and make it inactive during antibiotic therapy. The nurse will monitor closely for signs and symptoms of a hypersensitivity reaction. Which of these assessment findings may be an indication of a hypersensitivity reaction? Select all that apply. A. Wheezing B. Diarrhea C. Shortness of breath B. Swelling of the tongue E. Itching F. Black, hairy tongue. Answer: A. Wheezing C. Shortness of breath D. Swelling of the tongue E. Itching. Rationale: hypersensitivity reactions may be manifested by wheezing, shortness of breath, swelling of the face, tongue, or hands, itching, or rash. A patient with a long-term intravenous catheter is going home. The nurse knows that if he is allergic to seafood, which antiseptic agent is contraindicated? A. Chlorhexidine gluconate, Hibiclens. B. Hydrogen peroxide C. Povidone iodine, betadine. D. Isopropyl alcohol. Answer: C. Povidone iodine, betadine. Rationale: iodine compounds are contraindicated in patients with allergies to seafood. The other options are incorrect. The nurse is preparing to use an antiseptic. Which statement is correct regarding how antiseptics differ from disinfectants? A. Antiseptics are used to sterilize surgical equipment. B. Disinfectants are used as preoperative skin preparation. C. Antiseptics are used only on living tissue to kill microorganisms. D. Disinfectants are used only on non-living objects to destroy organisms. Answer: D. Disinfectants are used only on non-living objects to destroy organisms. Rationale: antiseptics primarily inhibit microorganisms but do not necessarily kill them. They are applied exclusively to living tissue. Disinfectants are able to kill organisms and are used only on non-living objects. A patient will be having oral surgery and has received an antibiotic to take for 1 week before the surgery. The nurse knows that this is an example of which type of therapy: A. Empirical, B. Prophylactic, C. Definitive, D. Resistance. Answer: B. Prophylactic. Rationale: prophylactic antibiotic therapy is used to prevent infection. Empiric therapy involves selecting the antibiotic that can best kill the microorganisms known to be the most common causes of an infection. Definitive therapy occurs once the culture and sensitivity results are known. Resistance is not a type of antibiotic therapy. A patient has a urinary tract infection. The nurse knows that which class of drugs is especially useful for such infections? A. Macrolides. B. Carbapenems. C. Sulfonamides. D. Tetracyclines. Answer. C. Sulfonamides. Rationale. Sulfonamides achieve very high concentrations in the kidneys, through which they are eliminated. Therefore, they are often used in the treatment of urinary tract infections. The nurse is reviewing the sputum culture results of a patient with pneumonia and notes that the patient has a gram-positive infection. Which type of cephalosporin is most appropriate for this infection? A. First generation. B. Second generation. C. Third generation. D. Fourth generation. Answer. A. First generation. Rationale. First generation cephalosporins provide excellent coverage against gram-positive bacteria but limited coverage against gram-negative bacteria during drug therapy for pneumonia. A female patient develops a vaginal superinfection. The nurse explains that this infection is caused by A. Large doses of antibiotics that kill normal flora. B. The infection spreading from her lungs to the new site of infection. C. Resistance of the pneumonia causing bacteria to the drugs. D. An allergic reaction to the antibiotics. Answer. A. Large doses of antibiotics that kill normal flora. Rationale. Normally occurring bacteria are killed during antibiotic therapy, allowing other flora to take over and resulting in superinfections. The other options are incorrect. The nurse is monitoring for therapeutic results of antibiotic therapy in a patient with an infection. Which laboratory value would indicate therapeutic effectiveness of this therapy? A. Increased red blood cell count. B. Increased white blood cell count. C. Decreased white blood cell count. D. Decreased platelet count. Answer. C. Decreased white blood cell count. Rationale. Decreased white blood cell counts are an indication of reduction of infection and are a therapeutic effect of antibiotic therapy.